Doctors of Reddit, what is a 1 in a million chance thing about your patient you have witnessed? I'm a speech therapist / speech language pathologist. I was a student when I saw a person who had fallen 30 feet through a disused factory roof. They had skull fractures, multiple strokes, multi-organ trauma and multiple spinal fractures and had a tracheotomy. I was there to assess speech and review eating and drinking. Reading their notes, I imagined there would be serious issues. They were able to eat and drink with only slight texture modifications. They could speak using a speaking valve and had no aphasia, problems with understanding or finding words, or dysarthria, unclear speech. They seemed slightly amused and bored of my assessment, took my notebook and pen and wrote "I can write too" in flawless handwriting and handed it back. I finished placement not long afterwards, but they were expected to make a full recovery. Not rare, actually the opposite, but something we don't see too often. I had a patient with early stage pregnancy and some minor bleeding. I did ultrasound and saw normal fetus but no heartbeat and told her that it was likely due to pregnancy just being at an early stage. I checked her ovaries and told her that I could print a picture of the fetus. I moved the scan back to the fetus and there was a clear heartbeat. During the minute or so that I was scanning the ovaries, the heart started to beat. I'm a nurse, and this happened at the hospital I work at, in the car park. A staff member got out his car and it started rolling. He reached in to pull the handbrake. From where I was sitting in my car, I didn't notice anything other than the car move, and the guy jumped back in his car. A few minutes later, a lady walks by and starts screaming. Turns out he had been pinned half inside his car by his car door, as his car had rolled towards the car next to him. He was unconscious, blue, not breathing. A bunch of us tried breaking into the car next to him to move it, and eventually, when there was about 20 of us, we actually managed to push his car back enough for PPL to pull him out. Luckily this happened at a hospital, so the crash team had already been called. They did CPR. He lived. I have a somewhat rare condition called hemicrania continua, a migraine headache on one side all the time. I have a stimulator implanted to interrupt the signals. It was an amazing thing to have it turned on after surgery and be headache-free. I was lucky to live near the #1 doctor for the syndrome. We walked in and he knew at once what it was. It took 5 years to get approved for the implant. My mother, now retired, was a GP in the middle of nowhere, in southwest France. In the early 90s, she had her first HIV cases. With the med at the time, they did not last long. Except one. Clearly HIV, but not developing AIDS at all. He was one of the few people with natural immunity. During my residency, I worked in a unit which did a lot of urology. We had a series of regular patients with urethral strictures, narrowing of the urinary passage, and they used to visit from time to time to get their strictures dilated. These veterans would eventually learn how to catheterize themselves. One of the patients, a young boy of 14 whose original injury had been a pelvic fracture in a road traffic accident, came to the ER on a Saturday in considerable discomfort. I was on call and asked him what happened. I passed this catheter in and I can't get it out. What he was using wasn't really a conventional urinary catheter which has a balloon at the tip to keep it in place, that can sometimes get stuck if the channel to deflate the balloon gets clogged. But that was not the problem here. He was using an infant feeding tube because the conventional catheters were too big for his narrow passage. The feeding tube is just a simple tube with no swellings and no mechanism to retain itself in the bladder, so I didn't really believe him. However, I found that he was right. I couldn't get the catheter out either. The catheter was fitting so snugly in the stricture that he couldn't pass urine and his bladder had filled up like a balloon about to burst. We took him to the OR and did a suprapubic cystostomy, basically made an opening into the bladder from the abdomen. This relieved the pressure in the bladder. Next we passed a scope down the SPC and found that the feeding tube that he had used as a catheter had gone into the bladder and got knotted around itself. Every time we tugged on it, the knot was getting tighter. We had to cut it off below the knot to get the rest of the catheter out. We got the knot out from the SPC. Inserted a urinary catheter to a female patient. She complains of pain where the bladder is situated, and it was distended. No drainage per catheter. When we pulled the catheter out, there it was, a worm which got stuck inside the tube. How the hell did the worm enter the bladder? Seen a patient whose triglycerides were so high that it gave him pancreatitis. They talk about it in the textbooks, but it is extremely rare. It was due to a combination of causes, including drugs he was taking for HIV. Now the crazy thing was when we drew blood it actually separated and there was a supernatant of fat that you could see in the vial. Not a doctor but a fireman/EMT here. We got called on a traffic accident one night, and when we got there was a guy hanging naked from a branch 9 feet in the air and a pool of blood below him. What happened is, it was explained to us later, the car he was driving lost control, started spinning in the road and eventually hit a barrier and came to a sudden stop. Due to the centrifugal motion of the car and the fact he wasn't wearing a seatbelt, he came flying out the back window of his car, landed on top of the tree and kept falling downwards, losing clothes on his way out. So we get him down, put him on a stretcher and sent him to a hospital. Sure enough, he was dead as there were no vital signs. Well, he survived and he comes and visits at the station every now and then. Obligatory: I'm not a doctor, but a coworker's son was born with hypoxic ischemic encephalopathy. Basically, the valve controlling blood flow to and from his mother while in utero failed, and he was born with 30% of the blood volume you're supposed to have. The EEG came back showing massive anomalies. Little dude wasn't quite at the threshold of brain death, but coworker and his wife were told in no uncertain terms that he would never live off a ventilator, and it was pretty unlikely he'd ever open his eyes. The hospital persisted with treatment, though, and brought in a trauma team who worked on him for nearly a week, before 3 more weeks in the NICU trying to control the seizures and prop up his organ function. Fast forward to yesterday, when the little dude made an appearance at a house party we threw. He's almost 2, and his neurotypical guy walked up our treacherous back staircase by himself and was talking up a storm in a language no one knows. He was a big fan of our cat. His entire trauma team came to his first birthday party, because none of them would believe it without seeing it. His entire brain basically regenerated and rewired itself after he was on the verge of brain death. It's the most unbelievable thing I've ever seen. Guy basically won the Powerball a couple of times in the first 2 weeks of his life. As a dentist, we are used to seeing unerupted teeth still stuck in the bone, which we call impacted teeth. The third molars are notorious for this. And after them, the canine teeth also get impacted. We confirm this when we see the radiographs of the patient. I was seeing this radiograph of a colleague's patient who had a missing canine which we were expecting on find impacted. We were not able to find it and thought it was missing. On closer inspection, we saw it impacted just below the eye, lying horizontally. ER nurse. We give an antibiotic called Rocephin very frequently for patients diagnosed with a UTI. The only complication I've ever seen from it is vomiting if it's pushed too fast. I had a patient transferred to me from our urgent care side who had walked in fairly healthy, but complaining of UTI symptoms. They had tested his urine, diagnosed him with a UTI, given Rocephin, and were planning on discharging him home with oral antibiotics. We still don't know completely what happened, but this is our best guess. We think he had a gram-negative infection that reacted to the Rocephin bilazine. The bacteria essentially exploded and raced through his body, putting him into almost instant septic shock. He had to be intubated and put on blood pressure medications to keep his BP high enough to perfuse his organs. His temp went from 98.6 to 104 in under an hour. A central line was placed because we kept running out of IVs to give medications. He was transferred to an ICU. I have never before visited a patient of mine in the ICU, but because of his drastic decline, I had to see him and know how he was doing. I cleared it with the ICU charge and visited him 2 days later. He was extubated and walking almost on his own. One of the fastest declines and recoveries I've ever seen. Had a veteran patient who had spina bifida on his problem list. Somehow he had made it, though, 20+ years in the military, and didn't get diagnosed with spina bifida occulta, which is present at birth, until after he got out. Have also seen atrial intramural hematoma, blood between the tissue layers of one of the upper heart chambers. Myxedema coma, end-stage hypothyroidism, which is quite rare in modern times. Mid-aortic syndrome, calcified blockages of the major blood vessel of the body, looks like coral on a CT scan. In an adult veteran, it is usually a childhood condition. There are probably more, I'll add them here if I think of them. My father is an anesthetist. I remember his 1 in a million, way more rare actually, thing happened when I was like 13. He was knocking a patient out for the surgery, did the pre-op stuff. The woman's consultation earlier showed no flags for anything major. She had a reaction, which can happen, such as malignant hyperthermia, but this wasn't that. Her reaction to the medication was where her own skin started to split and peel away from her body in large chunks. Her own body was rejecting her skin. The woman spent quite some time recovering. There was an investigation into the whole thing, but everything was done by the book and there was no reason for this to happen. The drug company was contacted and they had never heard or seen about this happening with any of the drugs. Drugs were taken and retested. This went on for a while. Turns out it was an allergic reaction to the drug, and it's just the way it presented. It was so extremely rare no one had seen it with the drug that has been in use for decades all over the world. My father ended up writing a paper on it. Not a doctor but a nurse. I work with a patient with CCHS, also known as Undine's curse. It affects around 1,200 to 2,000 people worldwide. You know how you can generally breathe without even thinking about it? Well, people with CCHS can't do that. They are generally either on a ventilator or hooked to diaphragmatic pacemakers. It sends an electric pulse to their phrenic nerve, which then causes their diaphragm to draw and breathe. Or they can do something called sprinting, which is just being off equipment for a few minutes at a time. If they focus on it, they can usually breathe in their own. There are a few other problems that are common besides just breathing, but I don't feel like listing them off. The most interesting part to me is the lore. According to French and German mythology, the nymph Undine discovered that her husband had committed adultery. Because he had promised his every waking breath to her, she cursed him that so long as he was awake he could breathe, but if he ever fell asleep he would stop breathing and die. Not a doctor, but a friend was living in South America 15 years ago. He had a cut on his leg and went swimming in some relatively clean water that had been sitting for a few weeks. It was a small tiled pool filled with drinking water. Enter flesh-eating bacteria on his scrotum. He was the second known case and the doctors had no idea how to treat him. They ended up cutting his scrotum open and scraping the infected cells off, leaving the wound open. Multiple times a day, nurses would clean the wound and pour sugar on it. Not too sure why, but it worked. He ended up living, and pictures of his testicles are now floating around in medical journals, as he was at the time the only survivor of this rare bacteria. I'm not a doctor, but my dad was diagnosed with hortencephaly. We don't know much about it since either the patients end up killing themselves because the pain is too intense, or someone in a crisis, because the pain comes only at night, up to 4 times a night. Each crisis lasts about an hour, is uncontrollable. There is no real remedy, since one drug might work for someone. My dad takes cardiac pills and it works, and won't for someone else. The doctor said the pain is like having an extremely hot ice pick inserted into the left side of the head, on the temple. Or similar to giving birth without epidural. But now it's in the head and it can happen 4 times a night. My dad's an emergency room doctor. He had to be the first to tell a teenage girl that genetically she was in fact male. It's a condition called complete androgen insensitivity. People with it display all the phenotypes of being female. In fact, they tend to appear as fairly tall and attractive women. But they don't possess ovaries and often aren't discovered until they don't get periods. So yeah, this girl came into the ER with a completely different issue. My dad took an X-ray and had to break it to the girl and her mom that she could never have kids. Obligatory. Not a doctor. I'm an ultrasound tech. I did a 3rd trimester growth scan on a pregnant patient. The scan wasn't necessarily indicated, but she had had a previous IUF. Baby died in the womb. Happens later than a regular miscarriage and is thankfully much more rare. The doctors wanted to give her peace of mind that everything was okay. What I found was a baby with a belly full of fluid, high drops. That's very, very bad. The fluid was surrounding all the abdominal organs and the heart. There are a couple reasons why it can happen, and the most likely one for this baby was a maternal infection. Our doctors sent the mother to MFM, maternal fetal medicine, specialists in high-risk pregnancy care, and they gave the same diagnosis. Baby was not expected to survive. The mother came back about 2 weeks later for a follow-up scan and the fluid around the baby was gone. Totally normal scan. Normal-looking baby. If the office had not happened to schedule this woman's ultrasound for that day, we likely would never have known it had happened. None of the doctors or techs at my clinic have ever seen a case of high drops spontaneously resolve like that.